Hi, I'm Dr. Elizabeth Bonet with FloridaPsychotherapy.com. I'm glad you're here today for a conversation on effective living. So today I'm going to talk about anxiety. And I absolutely love treating anxiety in my practice. I love the clients. I love seeing them get better. I love doing the worksheets. I really enjoy all of that. Occasionally I run across someone who said, who will say, oh, I went to therapy for my anxiety and didn't do anything. And I said, well, what did you do in therapy? Because anxiety is very treatable. And meaning like it's, you can get better with this treatment. It's not like there's a ton of studies that say, oh, you're going to have to go for years for anxiety treatment. It's not. You get better with anxiety treatment. So I say, what do you do? And they say, well, I just went in and talked. And to me, it's like, that's not going to help anxiety, just talking. The worksheets really help. There's a really good book that I'm going to show you here called Don't Panic, Taking Control of Anxiety Attacks by Reed Wilson, PhD. And this book is excellent. You can see how I have it all tagged up. It has awesome worksheets in it. It has a step-by-step process for you to follow and go through. So if you're having panic attacks or anxiety attacks, I would say, go right now to Amazon and buy the book. Seriously, it is really good, and you can work through it alone. I think it's often helpful if you have a therapist to work through it with you, who can often see things that you can't see. I definitely have clients who just have no idea about really how to write a script for themselves to help them handle their anxiety. So we go through that process together. We write a script that's effective, that helps them get better. We set up hierarchies. We talk about what are your motivations for treatment? What's going to motivate you here to really get better? Because just saying oh, I just don't want panic attacks anymore. I mean, yeah, absolutely. Anyone who comes to the office doesn't want panic attacks anymore. But just to say that isn't really going to get rid of them. So let's look at what's really going to motivate you. Okay, maybe you have kids and you don't want your kids to be limited in what they do by your anxiety. Oh, no, you can't take them to the park because you get too anxious being at the park or being around people or driving or this and this and this. And it's oh, as your kids get older, you start to see how your anxiety affects them. They take it on, and sometimes it limits them. And most parents don't want that to happen. They want their children to have a better life than they do. They want to see them happier. They don't want to pass on their anxiety to them. Sometimes that's unavoidable. There is this genetic component to anxiety, but it's not an either or. So it's really the wrong question to ask. Is this genetics or is this, something I can treat? It's both. Okay, is there a genetic component? Yes. Can you treat it with psychotherapy? Absolutely. Yes. So it's the combination of that. And it's all right, do your kids learn some of your behaviors from how you act around anxiety? Absolutely. Do they have your genes in them? Absolutely, they do. But it's anything that you can learn in your own therapy is going to benefit your kids. Hands down, it's going to help them. So if something comes up with them, you can be oh my gosh, I know what to do here. We go through, right in my mind, I go through the steps and I can help them feel less anxious and more comfortable and happier and calmer in their own life. And that's truly valuable. So that's just one motivation. People have all kinds of motivations, but we break those down and we say, all right, you really need to look at those when the anxiety comes up and you're oh my God, what do I do here? I can't do this. I can't do what my therapist said to do. It's all right, go back to the motivations worksheet. Go back to those in your head or pull it out and actually look at it and be all right, this is why I need to face this. This is why I need to do this. This is why I need to get a handle on my anxiety because of this, 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 and this. And that's how it's going to benefit me in my life. So often in the moment of a panic attack, our thinking brain isn't thinking that way. It's not thinking at all. It's just thinking fight or flight. That's it. And generally with anxiety, it's often flight, right? So that's why all that stuff helps so that you can bring it out and look at it and get your thinking brain going again, right? So we do all kinds of stuff like that, and we do worksheets, and I think it's really fun. Obviously, I'm a therapist, so I think it's really fun to treat anxiety. And in general, the clients report really good results from it, so it must be fun for them too. So that's it for today about anxiety. I hope the book helps you if you're out there struggling and either you can't afford therapy or you want to try it on your own first, something like that. It's a really effective book. I suggest you order it. Have a great day, and I'll see you next week.